So today we're going to dig into a solution for a really critical problem in community healthcare, that huge technology gap you see in small clinics. We're going to break down a brand new patient management system that's designed to pull these essential providers into the modern age. Let's jump right in.
Here's the thing. While medical science has been taking these massive leaps forward, the software running a lot of our local clinics, it's been left in the dust. We're talking about these rigid, clunky systems that have no cloud integration, no remote access, no modern communication tools. And that creates all sorts of bottlenecks, from just trying to schedule an appointment to securely accessing patient data.
Okay, so why should you care about this? Well, it can mean longer wait times, a ton of administrative hassles, and honestly, a real disconnect between you and your doctor. It adds friction to a system that really should be as smooth and efficient as possible.
So here's our game plan for this explainer. We'll kick things off by unpacking the big problems with these old systems. Then we'll introduce the modern solution and take a peek under the hood to see how it works. After that, we'll tour the key features for both patients and doctors, and to wrap it up, we'll talk about the challenges and what's next for this kind of technology.
All right, first things first, let's really get a grip on the core challenge here. Small clinics are often stuck between a rock and a hard place. They can't afford those gigantic, super complex systems built for big hospitals, so they're left with this ancient software that just holds them back.
And this comparison really just lays it all out, doesn't it? Legacy systems, they've got limited or zero remote access, and their security is often way out of date. They're crazy expensive and offer almost nothing for patients. But a modern patient management system, or PMS, flips the script. We're talking full cloud access, super strict HIPAA compliance for security, that's the US law protecting patient data, and affordable design, and awesome tools like telemedicine. Bridging this gap is absolutely crucial.
Which brings us to the hero of our story. This project introduces a new PMS that's been built from the ground up specifically for the needs of small clinics. It's designed to solve all those problems we just talked about.
And the goals for this thing? They're super clear and super practical. It needs to be a complete but lightweight solution that small clinics can actually afford. Security, of course, is everything, with HIPAA compliance baked in from day one. But ultimately, the whole point is to improve both patient care and the clinic's efficiency, freeing up the staff to focus on what really matters, your health.
All right, now for the really fun part. Let's peel back the layers and see how this system is actually put together. And don't worry, we're going to keep it simple, I promise.
So the whole system is built on this classic, time-tested pattern called Model View Controller, or MVC. Honestly, the easiest way to think about it is like a restaurant. The view, that's the menu you see. The controller is the waiter who takes your order and talks to the kitchen. And the model, that's the kitchen itself, where the food, or in our case the data, gets prepared and stored. Keeping these separate makes everything organized, scalable, and way easier to manage.
So first up is the view, also known as the front end. This is everything you, the user, actually see and click on. It's built to be fast and work on any device, and it's broken into three main parts: a portal for patients, a dashboard for doctors, and an admin dashboard to manage the whole show.
Next up is the controller, our waiter. So when you click Book Appointment, the controller is what grabs that request and figures out all the logic, like, is that time slot actually available? This system uses a back-end platform called AppWrite to handle all these interactions securely and really efficiently.
And finally, we get to the model, the kitchen, the brain of the whole operation. This is where all the really important info, patient records, doctor profiles, appointment details, is stored away safely. Using AppWrite for the database ensures all that sensitive data is encrypted both when it's just sitting there and when it's being sent back and forth. That is absolutely key for meeting those strict HIPAA privacy rules.
This diagram kind of shows how it all fits together. You've got a patient on the left and a doctor on the right, both interacting with the system. All their requests get routed through that central back end, which is powered by a platform called AppWrite. That thing handles all the heavy lifting like user authentication and data storage. And at the same time, there's another service called Sentry that's constantly monitoring performance and catching any errors in real time.
Okay, so we've seen the blueprints, we know how it's built, but what can it actually do? Let's take a tour of the features that make a real difference for both patients and the doctors.
So imagine you're a patient. The whole process is just simple. You register once, put in your basic info, then you can browse doctors, see their real-time availability, and just pick a slot that works for you. You hit confirm, and boom, an SMS notification zips right to your phone. No more being on hold, no more playing phone tag, it's just done.
The system is also really smart about who can do what. Patients get their own portal for scheduling and seeing their info. Doctors get a much more powerful dashboard to manage their entire schedule and all their patient data. And then you have administrators who have the keys to the kingdom to verify new doctors and make sure the whole system is running smoothly. It's called role-based access control, and it's a huge deal for security.
And this right here, this is a total game changer. Integrated telemedicine. The system lets you have secure, real-time video calls with your doctor, bringing healthcare right to you, no matter where you are. And that's not just about convenience. It's a massive, massive step forward for accessibility.
And beyond those big headline features, there's a bunch of other crucial stuff working behind the scenes. You get automated SMS reminders to help cut down on no-shows, and you can securely upload documents like lab reports. Real-time error monitoring with a tool called Sentry helps the developers squash bugs fast. And because it has a responsive design, the whole thing works perfectly whether you're on a desktop, a tablet, or your phone.
But of course, building something like this isn't all smooth sailing. No project is. So let's get real for a minute and talk about the challenges of building a system like this and what the future could look like.
You know, the creators were really upfront about the tough parts. Staying HIPAA compliant isn't something you just do once, it's a constant, ongoing effort. Getting high-quality video for telemedicine to work without lag, especially if someone has bad internet, that's really tough. And finally, you can test something in a lab all day long, but the chaotic, unpredictable workflow of a real, live clinic, that is the ultimate stress test.
But the vision for this thing definitely doesn't stop here. The roadmap for what's coming next is pretty exciting. They're planning to add a full electronic health records module and use AI to automatically optimize clinic schedules. They're even looking at AI tools that could help doctors with diagnostics during a consultation, which could lead to faster, more accurate care. It just goes to show this platform is built to grow.
So, that leaves us with this big question. By blending modern, affordable tech with a design that's all about the user, this system offers a really powerful, scalable, and secure alternative to that old, clunky software. It tackles the big problems, cost, security, and efficiency head-on. Could this actually be the model that finally lets the backbone of our community healthcare, the small clinic, truly thrive in the digital age? It sure makes a